89.9 KMOJ, today's R&B and throwbacks. Right now, it is time for Minneapolis 360. I'm Glam Life Kim, and on the line, I have one of my favoriteest people in the Twin Cities, Mr. Anthony Taylor. How you doing today, Anthony?
I'm good. Can you hear me, sister?
I can hear you.
Okay, I just got bumped off. So, when you're working, remotely, it's a little bit difficult. You get these phone calls, so I had to make sure that
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 you
you
were
could
still
that I
there.
was still here. How you doing, sister? I missed you last week.
I know, but I'm so happy to be here today. I am doing awesome. The sun is shining. It is still a little windy and it's a little chilly. And I was cracking up at Glenn talking about the woman's wig flying down the street.
Yeah, I was too. I always tune in before the show to get motivated, and yeah, he told that story. I just wanted to laugh. I mean, this brother need to be a comedian somewhere. He need to grab a mic somewhere and start to spit some jokes. But
Right.
she didn't think it was funny. I
I'm
bet you
sure
that.
she did. Well, probably afterwards. But at that moment,
Yeah, that was not fun and games for real. So,
right.
hey, Minneapolis, welcome to Minneapolis 360. I am your host, Anthony Taylor, neighborhood and community relations, coming to you every week, Wednesdays at 1 o'clock during the uh, trial of Derek Chauvin. We are weekly. I am glad to be with you. I think today, Kim, in Minneapolis, we're going to kind of transition a little bit from the trial because there has been some news from the governor announced last week that every Minnesotan over the age of 16 can get a COVID-19 vaccination. So a lot of our show today is just really going to talk about COVID-19, the vaccinations, what it all entails. I think if you've been listening in Minneapolis, you've understood that we've had a lot of shows talking about COVID-19 vaccinations, right? And this show has never been a show, and me personally, ever to tell folks what they should or should not do. One of the biggest things that I think this show does is give people the right information on COVID-19 vaccinations, the different types of vaccinations that are out there. Obviously, since the last time we talked about COVID-19 and vaccinations, there has been an additional vaccination that has came out open to the public, which is the Johnson & Johnson vaccination. So I want to kind of get into that because I think that's pretty important that we kind of transition and talk about this simply because we are not in different tiers and different phases anymore in the state of Minnesota. So now we need to kind of talk about that and what that means, how you can access that, and a lot of different things. And I've got a Hall of Famer on the line. One of my personal friends in the city, April Graves, is going to come on and just kind of talk a little bit more about what that means about opening up the vaccinations to the public. So we're going to kind of transition a little bit into that. But before we get into April and talking about vaccinations, I just want to make sure that we understand that the Derek Chauvin trial is still happening. I think they are now in recess until 1:15 today. This is day 3 that we are talking about this trial. And one of the things that I want to just share with the Twin Cities is the fact that I have, during my workday, have had time to kind of watch some of the trial. I've watched the opening statements. I've actually watched a little bit of day 2 and the day 3, and understand, Minneapolis, that these are some difficult things that I have witnessed. And I think a lot of us, even most of us who've probably been paying attention to this trial, either A, watching it live stream, or B, reading about it from their different ways on getting information. Did they get information? It's tough.
It's
It is
very tough.
tough. And especially, I think yesterday when they had the two young sisters on, the younger adult and the little girl that was on, made it really difficult to hear, along with the fact of watching Kim, the video, and even video that hasn't been seen before, how difficult that was, right?
Oh my.
So
I haven't even really been watching because even when I would go online and I'd see it, it just strikes a nerve, and it's hard for me. I don't want to relive that.
It is very re-traumatizing. It is very triggering. But Minneapolis, what I want you to do is pay attention to a couple things that I want to say. And first of all, we've had numerous shows regarding trauma. We've had some experts on to talk about ways to cope. If you've listened to anything, make sure you listen to what those experts told you about dealing with these things.
Mm-hmm.
I took some of their advice as well, and not necessarily listening and taking some time out, not necessarily going gavel to gavel watching it, but just to make sure that we understand the difficult days ahead. And even these first 3 days have been difficult, Minneapolis. So if you still want to be informed, you can still be able to watch the trial on minneapolismn.gov trial. There's also different places that you can call, especially around having folks being able to talk to. There's a support line that's open at 612-767-4158. The crisis line, also, you can text MN to 741-741 and able to get some support around that if you're having some trouble dealing with some of this information. So, again, Minneapolis, we are in a different place and a different time in our city. So we got to make sure that even if we are listening and paying attention, which in my opinion, I think you should, just make sure that you recognize your triggers, you take care of your body, and really try to center yourself as much as possible during this trial. So I just wanted to say that before we kind of transition, because it is difficult to watch.
Yeah.
With that being said, I want to introduce one of my favorite people of all time. Her name is April Graves. I think, April, this appearance on this show, you have passed the record as the most recurring guest on Minneapolis 360. So I just want to give you
Hands
a
clap.
clap on that, April. So April
Really?
Graves, welcome from the health department. Yeah, how you feel about that?
Oh, I'm honored, man. I'm excited. And certainly, I'll be happy to come back again and keep adding to that record.
Right.
You have blown everybody away, and the reason that I love to have you on this show, April, first of all, I respect the work that you do, but you also give great information. The way you present the information from the health department side, I think is wonderful. In Minneapolis, it's a privilege to have you a part of this program. So, what I want to do first, April, just kind of tell folks, what do you do for the health department with the city?
Thank you, Anthony. I've been with the Minneapolis Health Department for 4 years. I've been working in the Office of Violence Prevention. So typically my job is actually working with youth on the north side. I do a curriculum called Coaching Boys into Men with coaches and athletes at North, Henry, Cooper, and Edison. I've also worked with some of the summer athletic leagues like Change Equals Opportunity Run and Shoot out of Farwell Park, and also work in collaboration with the Minneapolis Youth Coordinating Board's Outreach and Engagement Team, or the YCB. So that's sort of my typical wheelhouse of work. But I also, participate with some of the other violence prevention initiatives. We work as a team within the OVP. But since COVID's been happening the last year, I've been really engaged in providing information to the community, getting the word out to businesses. At first, it was really focused on mitigation measures, and that continues now. But as time has gone on, we've set up testing clinics at various sites throughout the city, and now moving into vaccination. And also working on communication and messaging to the different cultural communities, trying to work in collaboration with other community organizations to make sure that we're communicating in ways that people can understand and that really resonate with them.
And what's great about you, you do great work in all of these buckets that you do, and I really appreciate you being on, April. And if we're talking about vaccinations, right, the governor announced something that was really huge, and I don't know if a lot of people understood or even got the information around vaccinations, right? So the Governor Walz, said that opening the vaccinations to everyone 16 and older in the state of Minnesota. Kind of, why did that happen, April?
Well, the real reason why eligibility is opened is because the federal government had promised to increase the supply of the vaccine by April. So now, while expanding it in Minnesota, there's different providers across the state that now have the flexibility to fill appointments and support the state's most critical goal, which is to get as many Minnesotans vaccinated as quickly as possible and end the pandemic.
And I think that's important because I think a lot around the country, there's a lot of states that's kind of revisiting how folks get vaccinated, right? So, with that being said, does that mean that everyone can get one now in Minnesota?
Well, while all Minnesotans will become eligible by next Tuesday, not everyone in Minnesota will be able to immediately make an appointment because there's still not enough vaccines available for every person today. But a lot more vaccines are on the way. Shipments from the federal government will continue to increase over the coming weeks, and the demand will still exceed the supply for now. But because there's not a vaccine for everyone, state health officials are still prioritizing vaccines for the higher risk groups. So even with this change in the state's vaccination qualifications, the city of Minneapolis vaccination sites are going to continue to only vaccinate people in the higher risk groups.
And explain those higher risk groups, April.
Well, we prioritize vaccination for groups that are high risk at a statewide eligibility level. So that would include people 65 and older, massage therapists, food processing workers, Minneapolis Parks and Recreation Board employees, frontline critical employees from the city of Minneapolis, unvaccinated people from prior eligible groups, so groups that were able to get the vaccine before now that really just haven't gotten it yet. And this week, the city is going to begin vaccinating grocery store workers and cosmetologists. And next week, the city is planning to start vaccinating food service workers, like those that are working in restaurants and bars.
So this opens up quite a bit for a lot of people in Minnesota. And one of the questions that I guess comes to my mind, April, and I don't, you can answer this the best you can. Is the third vaccine that kind of help kind of move this process along, getting the third one out to the general public when we're talking about the Johnson & Johnson vaccine?
I'm not sure specific to Minnesota, but, I would guess, and this is just a personal guess, that, any additional vaccine that's available, at the national level or even at, a worldwide level will probably make it easier to get the vaccine out to more people. But honestly, I'm not an expert. I do not know that for sure.
We are with April Graves from the Minneapolis Health Department talking about vaccinations, everyone. Governor Walz announced last week that anybody eligible, Minnesotans 16 years or older, can receive the COVID-19 vaccination. And April, as I kind of watch the news and I kind of get my information, it seems that Minnesota is doing pretty well when it comes to getting folks vaccinated, even before kind of this shift in the phases. Can you kind of talk a little bit about how Minnesota's doing, compared to other cities and states nationwide?
Yeah, I think, all of us were frustrated with sort of the slow pace of being able to get the vaccine, the supply in the first place. But Minnesota's actually been getting everyone vaccinated at a good pace. And just this past week, Minnesota was ranked number 1 in the country for the percentage of vaccine doses administered to Minnesotans. So just a few statistics are that 80% of Minnesota seniors are currently vaccinated, which is higher than the national average. And at least 2/3 of the school and child care personnel in Minnesota have also received a vaccination.
So that means that Minnesota's doing quite well. You talk about 80% of our seniors and at least 2/3 of our school and child care personnel in Minnesota are vaccinated. I think that's pretty big. Would you say?
Yeah, I think that it speaks to, the prioritization of where the vaccines should go right away, so seniors that were definitely at higher risk of, death if they were to contract the coronavirus. And then also, now that schools have reopened, prioritizing the child care workers and the school personnel in order to make sure that we're not transmitting back and forth to different households as much.
We are talking to April Graves, Hall of Famer on the Minneapolis 360 show, talking about vaccinations. And I say that with love, April, so I want to make sure you understand that. When we talk about this country and the treatment that it has inflicted on people of color, specifically Black folks in this country, and there's a long history of discriminatory treatment in this country. And we also understand, too, that our COVID statistics are disproportionately higher in our African American communities. And working with the health department, how do you kind of address the fact that this is something that our history, it is embedded in our history with the discriminatory practices in this country? What is the health department doing to kind of address some of those, to fight against this COVID-19 and the vaccinations that we're talking about?
Well, yeah, I mean, I know it's a lot,
And that's
right?
a tough question, right?
Yeah, I mean, these systems have been in place for a long time, and it's difficult to, readjust the way that business as usual has happened and caused harm. And first of all, I think the most important thing we have to do is that acknowledge that harm was caused. So that's where we have to start. And I think we've been doing that work within the health department with each other, and then also the work we're trying to do with the community. So what we've really been trying to do is build relationships that help to heal the trauma of our past experiences, do a better job at really listening to what the community is saying, and then working to build trust and equitable health outcomes. I mean, we know that the decision to take a vaccine or not is personal. Mm-hmm. We just want to give up-to-date information in a relevant and culturally appropriate way so that people can make the decision that's right for them. And, I mean, this past year has been super stressful and painful. I mean, it's going on more than a year now that we've been in both the pandemic and then coming up on the anniversary of the murder of George Floyd. And all of us, are holding a lot in this space, as you spoke to earlier, Anthony. So we're doing our best, one day at a time, to try to make sure that people are getting access to the information and to the resources that they need, to trying to change up some of the ways that we've typically done business with the city by giving more opportunity to the staff to work with the community and truly listen and bring that back to the leadership. So I hope that answered your question.
And it did, April. And this is such a tough question, and you shouldn't be the only one to be able to answer that, because it's not your question to answer, right? I think it's a systemic issue, but knowing that the work that you do, and when I hear you say build trust and listen to folks and making sure there's an equitable distribution of the vaccine, I think it's important to folks to understand that and really acknowledge the past traumas, and I think that's something that has to happen a lot when we have these conversations, when we have folks on our shows specifically from the city of Minneapolis. Just acknowledge some of the things that's happened in our past in our country. So you did answer that question well for me, and what I want to do too is just tell folks just really how important it is still to have masks and social distancing, to be able to still continue to keep doing that. Tell folks why is that important to still kind of follow the guidelines on our protocols with mask and distancing.
Well, I mean, even though people are getting vaccinated, we could still potentially spread the virus, and there's not automatic immunity when you first get the vaccine as well. You have to get 2 doses. There's not full immunity usually until about, 45 to 90 days later. So we definitely still need to follow the mitigation practices of washing our hands, wearing a mask, and practicing the social distancing, even as we all, or as most of us, start to get the vaccine.
We are talking with April Graves from the Minneapolis Health Department around vaccinations. Again, Minneapolis COVID-19 vaccinations are available to all Minnesotans 16 years and older to be able to get vaccinated. April, how can I get vaccinated if I haven't already?
So anybody who has not received a vaccine can sign up for a COVID vaccine on something called the COVID-19 Vaccine Connector, which was set up at the state level. You'll get entered to a random selection process for the state's community vaccination program sites. And then if you have questions and need assistance filling it out, you can also call the COVID-19 public hotline, which is 1-833-431-2626. 2053. Or an alternative would be to just contact your healthcare provider, a local pharmacy, or use the vaccine locator map to search for vaccine providers in your area.
And one of the things I think is important, and I've talked about this before, and we've talked about a lot on our show too, April, and is the fact that these vaccines are personal decisions, right? And I think ultimately at the end of the day, you have to do what's best for you and your family. And one of the most important things is for me anyway, is to be able to do my homework, right? So to be able to figure out from start to finish when these vaccines first started to come out late December of last year is really get to know about what's in the vaccines, what are the side effects, and also too in the back of my mind historically how experiments and things that have happened to folks of color, there's a negative history in our country around vaccinations, and I just wanted to tell Minneapolis that after I doing all my homework and making sure that I got all my facts straight and how it would affect me and what it could, I had chose to be fully vaccinated with the Pfizer vaccine. So as of a couple of weeks ago, I've got my second shot. I'm fully vaccinated, but just the depth of research that I had to do was so important that I made that decision. And I think it was something that I want to tell folks about doing their homework, and it's a personal decision, April, when it comes to deciding if you or your loved one should take or get the COVID vaccinations, correct?
Absolutely, Anthony. I mean, I also got the vaccine. I had been volunteering at testing sites, and I decided to get vaccinated because I was offered it as some of the first essential workers since I had been at those testing sites. And honestly, I wasn't 100% about it. I haven't always had the best experiences with the healthcare profession or medical professionals. I think largely because, I was lower income and had medical assistance for many years. And so I felt like I was mistreated. And I don't always get the flu vaccine. In fact, I've only gotten it once, so I'm kind of the practice that, like, if it ain't broke, don't fix it. But that doesn't mean that I haven't gotten other vaccines like the MMR and, polio and things like that for my kids in the past, because I feel like, my family has done that. So it feels safer to me. It's part of sort of, my upbringing. But I can totally understand people that choose not to do that. And I didn't exactly trust it, but I work at the health department. I had access to information probably earlier and at easier, an easier ability to really access the information to build my decision upon. And so I've been trying to make sure that other people know that. And so I decided to do it because I felt like, I was a leader, I was a mother, and I had access to information and I could share my experience. And the first shot, it was nothing, just kind of a sore arm. The second shot, I did kind of get a fever and felt like I had the flu for about, 10 hours or something like that. But I was able to sleep it off, and I was just fine the next day. And now my mom has gotten her second shot. And so our household, I think, the people that are most interacting with the public or the most at risk now are vaccinated, and that gives us some peace of mind.
And I'm glad you talked about that too, April, the side effects, because it's different from everybody. Mm-hmm. And in my experience,
my mom had none.
And
my
April,
mom didn't have any side effects.
And I didn't have any side effects either. And I'm glad you said that, because it's different between people, right? I think the only side effects I had was a sore arm, right? And that lasted 2 days with the needle, right? So any type of needle, folks been getting shots forever, but my arm was sore, but I didn't feel any fatigue or any side effects the first or the second shot. I know my mother received her first shot and she felt a little more fatigued than usual. But then again, it just depends on a different person, the side effects. And I don't know anybody who had severe side effects. So I'm glad that you're being open, and I'm trying to be open too about this too. And I think it's important to understand that, because there is some false information around that too that's out there. So
yeah, absolutely.
Really glad that you talked about that. So as we run up against the clock, April, just tell folks, what do you do while you're waiting your turn, right? How do you get tested? What do I need to do? I might not be able to get on that that list fast enough. What should I do while I'm waiting to get, if I choose to get a COVID-19 vaccination?
Well, yeah, definitely keep going and getting tested. They're encouraging people to get tested, whether or not you have symptoms, because it's one of the best ways to stop the spread of the virus and keep preventing others from being exposed, like our loved ones or other people that we're interacting with, especially now that, schools and sports and things are happening. Like I said before, keep wearing your mask and keeping 6 feet distance from people you don't live with, and then practicing, healthy hand washing. So there's plenty of places that you can actually get tested, and it's free. So you can find a current list of the free COVID-19 tests on the city's website. The state is also offering free at-home saliva tests, so any person in Minnesota can order a saliva test kit from the COVID-19 Test at Home program. Keep in mind that it's free, and you can do it at any time, so you don't need insurance for the test.
And one more time, the vaccine connector number, April, can you give it to them again?
The vaccine connector number is 1-833-431-2053.
April,
you can also go to the online website, Minnesota or mn.gov/COVID-19/vaccine/find-vaccine.
April, I know you're a busy woman, and you listed all the things that you are doing for the city and your community. So I always appreciate you being on this show, giving us information about anything that you come on, especially with vaccinations, especially with the work with OVP. So I know our listeners appreciate you being on. April Graves, I appreciate you, sister, for being on today, and thank you.
Yes, great job, April.
Thank you so much for inviting me. I'm happy to come back anytime. And I just want to reiterate, what you were speaking to earlier, Anthony, about the need for self-care, taking care of yourselves through all of this. As the weather is getting nicer, enjoy the sunshine, put your feet in the grass, find ways to be grateful and to just, get grounded and centered in your power, because we need ourselves and we need each other always, and especially when we're going through a continued crisis, and all of us are trying to heal from the trauma of the past year and a half. While we're still juggling what we're going through right now. So thank you so much.
April, before you leave, and I'm glad you brought that up, and we're just going to go just a little bit over. You do a lot with the embodied racism practice, and you're able to talk about breathing techniques and being able to do certain things. Give us a breathing technique that kind of help us kind of just relax, because you do a great job of that. So give folks some tips really before you leave about how do you take those breaths and what do you do to kind of center yourself around difficult times?
I think something that I always try to do is just become, really conscious of, simple things like the sensation of the ground beneath your body or beneath your feet, or the feeling of the sun on your face or the wind on your face. Feel like the length of your spine, sit up tall, let your shoulders relax down your back, open your chest, open your heart, as if you're ready to receive a blessing from the universe or from the Creator. And just take a nice deep breath in through your nose, allow your belly to expand, and then exhale all the air back out of your mouth and allow your belly to come back in towards your spine. And do that at least 3 times with intention. And you will feel a difference. It'll calm your mind, it'll slow your heartbeat, and it'll improve the blood flow to all of your vital organs. And that's really, living and being alive and appreciating that moment. The more we can do that, I think the better we can stand in our own power and show up for each other.
Mm-hmm.
Beautiful. Thank you as always, April.
Yes.
Thank you so much. Have a blessed day, y'all.
You too, hon.
You too. And I came, I know we're a little bit over time, but I just want to say that I think that works. I've tried that before. April has led a lot of different exercises that I've been a part of. And I just think one of the things that she talked about, just letting the air hit your face and feeling it and just being able to just sit in that space and enjoy. I just think the surroundings and kind of take it in helps out quite a bit.
Right. Absolutely. I think that's important. One other thing that I just wanted to, there's an ad that's playing on KMOJ that also speaks about, once you have the vaccination in your family, you can actually remove your mask and,
Mm-hmm.
so just some of the things to keep in mind, if you don't want to forever have to live with, wearing a mask every day. And, it is, unfortunately, you may have to make that decision to. And I won't say unfortunately because I believe it's a great thing. My mother, she took her vaccination. My sister has took hers, and I'm sure I'm going to take mine next. So
It's a choice, right? And we
it's a
talk about it
choice.
all the time.
Yep,
And
you have a choice
luckily,
to make.
I didn't have any symptoms, right? So
Right.
just a sore arm. But at the end of the day, just please make informed decisions, do your homework, and make
Mm-hmm.
sure it's your choice. So
Right.
I'm glad you're back in the seat, man. I missed you.
I
So
know. I am happy to be back. I was with my child. Well, I did an event out in Atlanta, but then, of course, my child is going to school there, so I was able to see him. So that was very exciting for me. I needed that.
of course, we all need
Mm-hmm.
that personal connection, especially
Mm-hmm.
with your loved ones. So
Yes.
yeah, appreciate you, Minneapolis. I will hear you. I will talk to you and see you next week. Be blessed.
All right, Anthony Taylor, we appreciate you. Coming up on the way, we've got Zany K, the loudmouth himself. He's going to bring you home this afternoon drive. Just after that, Walter Q. Bear Banks and N.I. is in the seat, plus Caddy, the Prince of Darkness. It's 89.9 KMOJ, the People Station.